Basal cell carcinoma. It is a slow-growing, local invasive. It is a malignant tumor of the epidermal keratinocytes, normally in older individuals. Only rarely metastasizes. It is the most common malignant skin tumor. It is the most common malignant skin tumor. Risk factors includes UV exposure, history of frequent or severe sunburn in childhood, skin type 1 always burns, never tans, increasing age, male sex, immunosuppression, previous history of skin cancer, and genetic predominance. These are the causes behind basal cell carcinoma. So what is this? Risk factors which which are UV exposure, history of severe or frequent or severe sunburn in childhood, burn, increasing age, male sex. Immune suppression is a very important one, and previous history of skin cancer. Previous history if someone is and genetic predominance. Presentation. Various morphological types including nodular, it is the most common one, superficial plaque-like, cystic, and morphoid, sclerosing, keratic, and pigmented. So what are the types? Various morphological types we can see here. There is nodular. Nodular is the most common one. Then superficial, plaque-like, cystic, morphoid, or is also called sclerosing, and another one is keratotic, and another is pigmented. Nodular basal cell carcinoma is a small skin-colored papule or nodule with surface telangiectasis, telangiectasia and a pearly rolled edge. The lesion may have a necrotic and ulcerated center, which is also called rodent ulcer. So it means it is a nodular basal cell carcinoma, which is small skin-colored papule. Like pigmentation is like a normal skin color or nodule, skin color or nodule with a surface telangiectasia and pearly pearly rolled edge. Pearly rolled edge. What kind of edge? It's pearly rolled edge, and the lesion may have a necrotic or ulcerated center. That's why it is called rodent ulcer. There is a necrotic or ulcerated center in the lesion, and most common over the head and neck. So it is most commonly seen in head and neck region. And how will we manage this thoracic carcinoma? Surgically, we will give surgical incision treatment of choice. Surgical incision is the treatment of choice, and it always histological examination of the tumor and margins. Before we will do surgical excision, we need to do histological examination to identify the malignant cells present there. So, treatment choice, surgical excision. Most micrographic surgery, like excision of the lesion and tissue borders, are progressively excised until specimens are microscopically free of tumor. For high risk and recurrent tumors, this surgery is recommended for high risk people or someone who are getting tumors, more frequent tumors, recurrent tumors. We will suggest this. Yeah. So another one is radiotherapy. When surgery is not appropriate, we will go for radiotherapy. Others, some other options. So we can see there is cryotherapy, cryotherapy, curettage, cautery, topical photodynamic therapy, topical treatments for small and low risk lesions. If we see that the lesion is small and low risk, so we will go for this small surgeries like cryotherapy, cautery, this kind of surgeries. Complications, and here we see the picture of this villus carcinoma. We can see here complications: local tissue invasion and destruction. This is the complication: local tissue invasion and destruction. Prognosis depends on tumor size, site, type, growth pattern, and histological subtype, failure of previous treatment, recurrence, or immunosuppression. It depends on size, type, and where it depends on the size, how the tumor look like, and what is the site of it. It depends on that. If the patient is immunocompromised or not, if the patient has any other comorbidity or not, we have to see this. So this is all about villus carcinoma.